Hi, my name's Debbie Taylor-Payne and I'm the SMI Annual Health Check Champion. So today I'm going to introduce the topic of onward referrals and signposting for those completing a serious mental illness annual health check. Those with a serious mental illness such as schizophrenia, bipolar disorder, psychosis, experience the greatest health inequalities, and sadly life expectancy is 15 to 20 years shorter than the average population, with the majority dying from preventable illnesses like cardiovascular disease and smoking-related illnesses. So every year those on the SMI register are offered a health check, and this can be a good opportunity to discuss physical health goals such as movement and fitness, offering ongoing support through, for example, social prescribing for early intervention and preventing those long-term conditions. And in order to meet that person's needs, it's not just about the physical side of things. I think it's good to think of it as a biopsychosocial approach to care. And what that does, it considers the whole person. And there are a range of factors that contribute to that person's health. So the biological considerations include things like physical chronic conditions. It could be genetics, it could be how that person reacts to stress, it could be medication side effects, nutrition, but also we've got social factors, and it's about addressing those support needs, things like housing, employment, economic status. They might not have a great deal of support, so it's looking at the whole of that person's life. And those living in deprived areas experience more health inequalities. Psychological factors to recognise include emotional distress, such as past traumas. That person's coping skills may contribute to the person's ability to engage in services. It could be about that person's perception of themselves, and that can cause them to avoid seeking support. The SMI annual health check very much focuses on the physical elements, and it's not a requirement of the SMI annual health check to talk about that person's mental health as such. But what you can do is ask that person how they are managing, if there's anything additional that they need support with. And it's this person-centered approach, collaborating with the patient, respecting their preferences and readiness to try new things. So it may be that you do need to refer them to other services like social prescribing, which we'll come to later on. But there are also peer-led organisations like the Recovery College that can be really useful and effective. So it's about looking at the whole person. What does that person need in terms of ongoing support? Obviously, as a clinician, you might not have a great deal of time in your consultations. So it's about really thinking about what is the intervention, what is the onward referral, where can that person be best supported outside that appointment. And it's good to just compare the differences between signposting and referrals. So if you are signposting someone after their appointment, it's about providing contact details like a phone number, email or website details, and that person would then contact the organisation themselves. It may be that they do need somebody else as a kind of a middleman, if you like, or a middle person who can help and support them to do that. So this is where your social prescribing team come in. A referral is actively linking that patient with an organisation or a professional. So, for example, if you are referring that person to, I don't know, the Ageing Well practitioner, then you would be sending a task to that person to get them to follow that up, obviously with the patient's consent. You could be contacting an organisation on that patient's behalf. So you might be ringing up like Staying Well or another voluntary organisation. So, tips on signposting. You're not expected to be an expert on where to signpost people to, but if you can get to know a little bit more about your local area, it just gives you that little bit more confidence when you're dealing with people. And if you do feel that you're not quite there, you can signpost that person to a social prescriber with that person's consent, as always. And the social prescribing team, they do have time to spend with the patients. They can provide that personalised care and help them to achieve the goals. And it's about matching the person's needs with the service. We also have people within the primary care networks and professionals within Pennine GP Alliance who might be able to help, such as occupational therapists, ageing well practitioners, mental health practitioners, and trainee advanced clinical practitioners for mental health within each PCN. A good starting point in Calderdale is Calder Connect, and it's an adult information and directory service. And there's lots of organisations on there. It could be, to do with physical health, it could be to do with mental health, or just social groups. There's something called the VSI Alliance Directory, and that highlights the work of the voluntary sector in keeping people well. And it's got included information on such as Mind, Rethink Mental Illness, Healthy Minds, Unmasked Mental Health, Andy's Man's Club, Noah's Ark, Athletic Minds, and the Women's Centre. So there are lots of organisations within that you can have a look at and see what is most appropriate, or you can direct the patient to that online directory if they are computer literate. Community hubs and faith groups are also a good starting point. Make sure it's documented on the health action plan or written down so that the patient can refer back to it as well, because sometimes in a busy appointment there can be a lot of information to take in. So if you can write it down for that person, or even record it, the person records it on the phone, they've got it there and they can access that information quickly and easily. Patients may have multiple barriers to access their appointments. It may be that there are barriers to any follow-up support as well. Financial issues may prevent them from attending appointments. Mental health symptoms can affect mood, motivation, memory, and the ability to engage generally with people. Chronic physical health conditions, long-term conditions, may mean that they miss appointments, or it can impact on things like their mobility. In that kind of a case, it's always good to be able to consider a home visit. Fear and stigma may be a concern, worrying about being judged and maybe mistrusting other people. So no easy answers, and there may not be quick fixes, but it's about building those relationships, developing trust, getting to know that person, problem solving, and encouraging them to take small steps, and gaining support from others to make those small changes. There might be people around them who can support, like carers, or it could be external organisations, helping them to attend the appointment in the first place and then to implement new routines. So from this video, what are the take-home messages? What can you take away from this session? Do you feel more able to signpost or refer people to another service? Do you feel more equipped to collaborate with across teams and services to provide that wraparound support that people might need? Is there anything that you feel that you need to or you'd like to learn more about? just reflect for a few moments on what impact this session has had. Any further support you need, please do not hesitate to contact me. And if you'd like me to attend your practice or to attend a Microsoft Teams meeting, I'm always available. Thank you.